Good morning, everyone. I'm Dan Yeager, Executive Director of NEMA, and I'd like to welcome you to the 103rd NEMA Conference. If you're anything like me, I'm sure you thought last year would be our first and last virtual event. But alas, COVID is still with us, and we're still separated by a screen. On the bright side, this allows us to gather together in a way that recognizes the reality of many of our lives right now: multitasking, juggling hybrid events, toggling between commuting and working from home, continuing to make time for self-care. As you scan the NEMA conference program and ask yourself how you're going to make time for all the wonderful presentations, at least you know in the back of your mind you can always watch the recordings later. However you show up for the 2021 NEMA conference, the NEMA team is extremely grateful that you're with us. Before we get started, I'd like to acknowledge the places in which we gather. In this era of virtual meetings, when digital spaces may substitute our physical sense of place, it's important to redirect our attention to the land we each occupy in this moment and honor the Indigenous people who have called it home. NEMA's offices are located in Arlington, Massachusetts, homelands of the Pawtucket and Massachusetts peoples. Wherever we are each located, let's acknowledge all Indigenous nations as living communities, their elders, both past and present, as well as future generations. NEMA recognizes that our organization and those of our members were founded within a colonizing society, which caused the exclusions and erasures of many Indigenous peoples throughout New England and beyond. Thank you for helping us challenge these practices by disrupting and dismantling the ongoing legacies of settler colonialism. And now I would like to introduce Loren Spears, NEMA board member and executive director of the Tamaquag Museum, for a welcome and greeting.
Askawi Kwasin, Natasuis Makasini Pashao at Nahai Gansek, Natasuis Loren Spears at English at Ni Nahai Gansek Nahantek, Kanupiam at Aki at Nahai Gansek. Hello everyone, I'm Loren Spears, the Executive Director of Tamaquag Museum in Exeter, Rhode Island, and I am known as Makasini Pashao in my traditional language, and I am greeting you here today and welcoming you to my homeland of the Nahai Gansek people. Kanupiam wuchi ni tampawag ka ni tanksawag at aki at Nahai Gansek, ka wuchi wami naninamasnawak. Katabatash katantwa wuchi wami nawia nakan wuni tiawak. Katabatash katantwa wuchi wuni kisak. Katabatash katantwa wuchi nipawus ka matakwasag. Katabatash katantwa wuchi wata. Katabatash katantwa wuchi kitan. Katabatash katantwa wuchi namas na peshuag kawami panashamwak. Katabatash katantwa wuchi wami paman tamwe tian taguanash. Katabatash katantwa wuchi sokanun kacha usha niempaog ka wayupayanash. Nashbi mishatashan pianwak kachisatao. Kakantamwu wami sakwan kisakwan takwanek kapaponi pashao nashbi wuni tiawank. Katabatash katantwa ut uchi tianguanag. Katangkwaman ut anantam mahug akan nashawank. Kanashawank u Kuchisamau Onkung Ginawan. Kakantamwu Ginau Aquane Wami Pashanki. Katabatash Namanatuman Wuchi Wami Wunitiawak Ni Nawania Nakan. Katabatash Wuchi Wami Kamaguanash Namanatum Ni Naj. Katabatash Aquane Ka Nuanantam. So what I shared with you in our language is a blessing for the day and a greeting. Welcome to all my friends and relatives to the homelands of the Narragansett and the homelands of all Indigenous people across Turtle Island. Thank you, Creator, for all the beauty that surrounds us. Thank you, Creator, for the beautiful day. Thank you, Creator, for the sun and the clouds. Thank you for the forests and the ocean. Thank you, Creator, for the fish, the birds, and all animals. Thank you, Creator, for all living things. Thank you, Creator, for the rain, the thunder, lightning, and the winds. With a storm comes a cleansing. We wish all the seasons, spring, summer, fall, and winter, to burst forth with beauty. Thank you for our ancestors, they who suffered, mind, body, and spirit. Their spirits wash over us. We wish all for peace in the future. Thank you, Creator, for all the beauty that surrounds us. Thank you for all your gifts. Amen, or Ninaj. Thanks, peace, and blessings to all. Enjoy the conference. Walk in beauty.
Thank you, Loren, for that kind greeting. I'm so grateful for all of those committed to our museum field who helped make the conference possible. We're offering more than 50 sessions thanks to our colleagues who want to share their stories and expertise. And a special thanks to our keynote presenters who will be providing insights into today's most pressing topics. Dr. Lisa Wong, who will be in conversation with NEMA board member Brooke Evans in just a few minutes, and Michael Bobbitt, who will be speaking with me on Wednesday morning. I'm especially thankful for our sponsors who have stepped up their support of the NEMA conference. Sponsorship funding has allowed us to offer a range of registration options that makes the conference accessible to everyone, regardless of their financial circumstances. And for that, we are exceedingly grateful. Many thanks to our keynote sponsor this year, Collector Systems. Sponsors at the platinum level include Catalog It, sponsor of closed captioning for all of our sessions, 42 Design Fab Studio, Gorman Richardson Lewis Architects, Harvard University Extension School Museum Studies Program, International Tennis Hall of Fame, Museum Search and Reference, Tufts University Museum Studies Program, and University of Massachusetts Boston Public History Program. Gold level sponsors include Arcana Workshop, Lucidia, Skinner Inc., and TrueView. Thanks to our silver level sponsor, Studio Robertson, and bronze level sponsors, Borderland, The Life and Times of Blanche Ames, Documentary Educational Resources, Museum Insights, Museum Textile Services, and Quatrefoil Associates. And many thanks to the generosity of our scholarship underwriting partners, Connecticut Humanities, Connecticut Office of the Arts, Mass Humanities, Massachusetts Cultural Council, Rhode Island Council for the Humanities, Vermont Humanities, and History Cambridge. Thanks also to scholarship sponsors, including Cynthia Robinson, Laura B. Roberts, the International Tennis Hall of Fame, the NEMA Board, and those of you who contributed to the NEMA Annual Appeal. I would also like to thank all of our virtual exhibitors this year. Just like other years, our virtual exhibit hall is the place to go to discover the latest museum-related products and services and to learn tips and techniques to expand your professional toolkit. Just click on the exhibit hall button on the Whova navigation bar on the left side of your screen. And now it's my great pleasure to introduce our Day 1 keynote presentation with Dr. Lisa Wong in conversation with Brooke Evans on the topic of resilience, healing, and museums. Dr. Wong is a pediatrician, musician, and author dedicated to the healing arts of music and medicine, with deep insights into how cultural workers can leverage their personal and institutional assets to improve well-being. She is Associate Co-Director of the Arts and Humanities Initiative at Harvard Medical School, where she teaches, and has been Board President of the Longwood Symphony Orchestra and Board Member of the Massachusetts Cultural Council. Brooke Evans is the Director of Visual Arts Education at Brigham and Women's Hospital in Boston, a new position that signals growing acceptance of arts and culture as a healing modality in the healthcare system. Brooke's prior experience includes the Museum of Fine Arts Boston, Harvard Art Museums, Harvard Museum of Natural History, Plymouth Plantation, Boston Museum of Science, and the Peabody Essex Museum. She has served as president of the Museum Education Roundtable and is currently a board member and officer of NEMA. Thank you both for agreeing to lead this fascinating conversation today. Okay, here we are.
Hello. Good morning.
We made it.
Good
We made
morning.
it. Yeah, welcome everybody. The technology is working, and welcome to everybody out there in Zoom land. We're so grateful that you're with us for this conference. It really is going to be, I think, a terrific experience. So we're very grateful that you're with us. So I wanted to tee up this conversation a little bit. I'm so excited to hear about this interchange between you two, and I'm going to put it a little bit into context of where we are right now, and then I'm going to jump out of the way for a half hour or so and rejoin you to talk questions and answers and monitor the chat. For everybody in the audience, please use the chat in the Whova app along the right side of your screen, and I'll be watching that. So if you have any questions of Lisa and Brooke as you go, please put those in the chat, any thoughts or reflections, that type of a thing, and I will relay those to them, and we'll talk for about 10, 15 minutes towards the end of our time together. But I wanted to just lay it out there that we are in such need of hope and resilience right now in our museum profession. I think just reflecting on hearing folks over the last several months that I've talked to, the pandemic obviously continues to stress us mentally, physically, and emotionally. We're busy caring for ourselves and our communities, so there's a great deal of stress involved there. There's ongoing economic stress and workplace upheaval. We're, I think, still recovering as a field from all the furloughs and the layoffs that we've had over the course of the last 20 months. And in some institutions, the pains of change continue to be evident. We saw news this week that the MFA workers union at the MFA Boston is due to be on strike on Wednesday, and just acknowledging that and holding that in our consciousness. And then, of course, we've been so actively involved as museum professionals the past 2 years, and perhaps even more, with social justice and equity and anti-racism, which continue to be major sources of concern in our museum community. The work is progressing, but it's hard work, and burnout is a constant threat when we're tackling those big issues. And I guess, I hope I'm safe to say that many of us thought we would be out of the woods by now. I think that, we really fully anticipated, obviously, that this conference was due to be in Newport, Rhode Island, and we had to cancel it once again. We thought we were going to be there. There's a feeling of letdown, of resignation, of burnout, of sadness that permeates what we do. And I know we're trying to keep a stiff upper lip and keep the work going, but sort of general sense of we need something as museum professionals to keep us going. So reflecting, Brooke and Lisa, welcoming you. This is, I think, a terrific conversation to help us both as professionals and also personally, to give us a little bit of a roadmap and an anchor. So over to you both. Thank you.
Great. Thanks, Dan. Good morning, everyone, and welcome to the NEMA conference. It's so exciting to be with you. And thanks to the NEMA staff for inviting Lisa and I. And I should just note that my cat might become an additional presenter during this conference. So she's staring at me right now from the corner here. So I want to offer a warm welcome again to Lisa for joining us. Lisa and I have collaborated on so many things over the years. We actually couldn't remember the first time that we met each other and how that even came about, because it's been so long that we've been working together. And we also wanted to acknowledge that we're returning to a conversation that was started at NEMA several years ago with a variety of folks from the medical community. And we're happy to see that conversation continuing, and to really share with you today where we hope that that's going in the future. So we're going to start with a little bit of our personal experiences, and then kind of move into sort of the larger national and international trends that we're seeing in this work. So to get us started, maybe Lisa, if you could just tell us kind of briefly how you got here.
Thank you, Brooke, and thank you, Dan. Also, welcome to everybody on this beautiful Monday morning. I'm really honored, actually, to be here as a physician and a musician predominantly, but also as one of the associate co-directors of the Arts and Humanities Initiative at Harvard Medical School, because this is important work. It is hard work, and in the introduction that Dan just outlined, we really acknowledge that burnout and stress are something that is really quite universal. And it was accelerated during the pandemic. So my work as a physician started back in the 80s when I became a pediatrician, but I only became a pediatrician knowing that I would be able to incorporate music into my work. And so a lot of my brain is in arts education and music education, and then applying it to how to interweave that into healing through the arts, as well as healing through the other art, which is medicine. So I started doing that ever since even medical school and my work at Mass General. But it became much more clear when the Arts and Humanities Initiative came about, and we looked around, and people like Dr. Joel Katz and um, and Dr. Shah Koshman, who you both of whom you know, Brooke, and others. When I asked them, why do you do art and medicine, or why do you go to the museums and medicine, or why do you write as a doctor? Each of my colleagues said, because it makes me a better doctor. It helps me to understand the human experience, and it helps me to empathize. And so then we realized that each of us was coming from a different art form for the same purpose. And that became a real pipeline then, that we could really make the connection that art and medicine and art in every form are interrelated.
That's great to hear. And I feel like it sort of echoes some of how I got into this. About 10 years ago, Dr. Katz came to the MFA to do a program, a pilot program that he was just launching. And I was just sort of blown away on how the arts could add to the skills, add to wellness, opportunities for self-reflection. And I was like, how can I get more involved in this?
And
So
Dr.
this,
Katz, of course, he's a practicing artist. So he's
mhm,
a visual
mhm,
artist who was trained as a visual artist before he became a physician, and now he runs the residency program at the Brigham and Women's Hospital. So
mhm,
he really has an influence on the young doctor as they come through, and
mhm.
has incorporated that into their training, is to come to the museums as part of their training.
Yeah, yeah, and your work too at the Harvard Medical School. So getting doctors even before they become residents is great. So this conference is focusing a lot on sort of wellness and resilience. How have museums contributed to your work as a doctor in this realm of sort of wellness?
Yeah, well, thanks. You alluded to the work that we do at the Arts and Humanities Initiative is predominantly at the medical school level. Um, but we know from even K through 12 and in through college how important integrating the arts into curriculum is, because it gives the young person ex additional tools for resilience and tools for reflection and empathy. And so in medical school, we found that especially um, this generation of medical students, most of them come in with an art form.
Mhm,
Many of them are already writers. Um, Significant number of them are musicians. They, if we invite them to look at art and invite them to draw again or use their hands, it's a feeling of recognition and coming home for them,
mhm,
because many of the students when they come to medical school feel like, oh, now I have to be a grown up and give up those silly art things and be a real doctor.
mhm.
And so the look of relief when we say, oh, no, no, you are a real doctor if you practice an art form as well, is a real gift to them. And they have this look of like enlightenment that, oh, thank God I can do that. And so the
Mhm,
museums can really offer for them a haven, a real safe haven for their mental health, and also gives them a chance to slow down, back up,
mhm,
get out of the hospitals,
mhm,
reflect on what it is that they're doing, and remember the reasons why they went into medicine in the first place, which is
mhm.
to experience the human experience more deeply and to help others to regain beauty and to heal.
Yeah, when I was trying to remember back to how we first met, I was remembering a day term class that we taught for Harvard students who are interested in going into medicine. And we talked a lot about sort of the intersection of the arts and medicine. And I remember so vividly at the end of that workshop, a lot of the students were musicians, and they said, oh my God, like I've just realized I don't have to give up my music to go to medical school. And it was such this like wonderful revelation for them. It just felt like they were so happy that they didn't have to leave this part of their life behind.
Yeah,
So
that experience really was pivotal for me, that we worked together, Brooke. And so now I teach a seminar at the college, at the undergraduate college, on the role of music in education and health, again for pre-med and neuroscience and psychology majors who are some of them are phenomenal musicians. In fact, one of them is away from the college, from the campus this week because he's conducting in Austria. Um, they all have their own talents, but to be given this opportunity to realize that they can balance their science and their art. And so actually what I've incorporated into the course is to take them to the Harvard Art Museums. So we couldn't do that last year because of the pandemic, but the year before and this year, actually just a few weeks ago, we brought the students there and they immediately put the parallels together about um, it's not just music and education and health, but the arts. And they were so happy to be back in the art museum.
Yeah, it's wonderful. I think, from my perspective, what I always see when I work with doctors in museums is just this immediate sort of sense of releasing the stress, like their shoulders almost drop when they walk into the environment. And it's such an important opportunity to really share their thoughts and experiences with one another. Sometimes one of the first opportunities they have to really go deeply with what they're experiencing, either as a medical student or resident or a more senior clinician. And I think what always inspires me is it just shows how relevant the work is in the arts and how important it is. So that's great to see. So kind of building on that, so our work really focuses on the value of this sort of interdisciplinary connection through arts and medicine and arts and science. And a lot of that, as we see here with the two of us, is through collaborations. So can you speak a little bit about how you see this going in the future? How do we demonstrate this value to others that aren't like us and might not see it yet?
Well, there's so many opportunities to use places like the art museum as a place for reflection. And so when you're thinking on different levels, we were talking recently about the personal level where the frontline worker, the doctor, the stressed, almost burnt out medical student needs to have an opportunity to use the techniques of slow thinking and mindfulness, and the museum is a perfect setting for that. But beyond that, helping to really enhance empathy and have them working together as a team, but then stepping back and saying, what was that process that we just did? How do we take those ideas and translate them back to the wards or back to our labs, back to our classrooms, and really letting them do that kind of balancing. And then stepping back even more, as Dan was alluding to, how does this relate to social justice? How does this relate to economic disparities and social determinants of health? And all of those topics can be really addressed in a safe environment in the museum, and often using a work of art as a metaphor. So that's a safe space for people to really feel that they're outside of their regular work environment, but they can really tackle some of the real important issues of the day.
Yeah, I agree. And I feel like that collaboration piece is key. Whenever someone sort of asks me to talk about these programs and kind of what I do, I always stress that when I'm leading a session, my ideal environment is to lead a session with a physician. So you and I have led many sessions together, but it's that opportunity to bring in both areas of expertise, the expertise from the art educator and museum educator side, and then the expertise from the physician side. And they complement each other really well. And I think for the people taking the program, having both those perspectives can be really enlightening. And as you said, they often bring things back to their clinical practice. So you and I were talking earlier about how this work really seems to be growing. We're seeing a lot of wonderful national trends and even international. The World Health Organization now has an arts and healthcare division, and someone who runs it regularly attends many, many meetings, which is great to see. So can you talk a little bit about some of the national trends that you are seeing?
Yeah. So the Arts and Humanities Initiative at Harvard Medical School is only one of many such programs all across the country. And There are medical schools that have medical humanities programs or narrative medicine programs, and there are partnerships among the medical schools with their local art museums all across the country. So this work is really building. It's being supported by the National Endowment for the Arts. As you mentioned, the World Health Organization is now um, interested in it. And very recently, the AAMC, which is the Association for American Medical Colleges, came out with an initiative called the FRAME Initiative, the fundamental role of arts and humanities in medical education. So no, it is no longer something that we aspire to be at the table, but now the AAMC has acknowledged that arts and humanities is something that is important for medical education. And also the National Academies of Arts, of National Academies of Science, Engineering, and Medicine have also come out with a consensus report about the interdisciplinarity in higher education and how important um, engineers, physicians, graduate students in the sciences, how important the arts are for them, and the other way around, how important the sciences are for the arts students too.
Yeah, and as Dan mentioned, I recently started this new position as a director of visual arts
Yeah.
education at Brigham and Women's Hospital, which is
Congratulations, by the way.
wonderful.
We're so
Thank you.
excited.
But when I've talked to people about this position, one of the things that they often say is like, "Oh my God, I can't believe there's a position like that in a hospital." And so, I think things like that, and thanks to Dr. Joel Katz and to the funders who were really forward thinking to create this position, but to have that and hopefully my hope is to be able to, have a position like mine in every hospital. I think
Yeah,
another
but
thing that,
when I think about the role of the arts, the role of museums in science and medical education, it also spans a whole gamut. So it's not only the experiential and the internal work that physicians and medical students need to do, or the group work, but there's actually scientific work that is also going on
Mhm,
as well, neuroscientific
mhm.
work.
Yeah.
What does it, what happens to the brain when you're looking at art? What happens to the brain when you're immersed in art or you're conversing in metaphor and all of those things? So there's an opportunity for people to get on the train at different parts or on
Mhm,
different cars of the train. If you're a
mhm,
basic science person, there is a place for that. And if you're someone who is really interested in social justice and teaching that to the students, there is a place for that. And so
mhm,
really arts and healing is also expanding its definition, which is very
mhm.
exciting too.
Yeah, definitely. And I'm so glad you brought up the neuroscience part because Bonnie Pittman, who many people are familiar with, and is just a wonderful museum colleague, has been doing a lot of work around that with the University of Texas. And so I would encourage everyone to kind of Google her and see what she's doing if people are interested. The other thing that comes to mind is the National Organization of Arts and Healthcare, NOAA, which was formed several years ago, but they've been doing some phenomenal work. And they actually just recently published a curriculum for folks that are interested in how to really build their skills in this intersection of art and science and how to collaborate with medical facilities. And so that's a wonderful resource. And the other thing that sort of comes to mind is the University of Texas, or I'm sorry, the University of Florida, and Dr. Jill Sankey, who's been doing a lot of amazing work. And she was actually just recently working with the CDC on how to use the arts to talk to people about COVID and vaccines and healthcare during this pandemic. So that sort of brings me back to the pandemic because we're still unfortunately living in it. How has this work pivoted, do you think, during COVID?
Well, I'll speak on two things. One of them is through the music side, because I'm mainly a musician. But the Boston Hope Music Project was started during the pandemic, when the Boston Hope Hospital was started at the convention center of all places. We saw that the Army Corps of Engineers was able to put down 1,000 beds in a week, but it's a very cold space, even on a good day in that convention center. So it was cement floors and just booths essentially with cots. And so we saw Dr. Ron Hirschberg is the chief medical officer, a musician himself and a rehabilitation doctor. He said, they're going to need more than pulmonary rehabilitation, physical rehabilitation. They'll need some mental health support as well. And so they put in mindfulness, meditation, and music. And so that gave us the opportunity to invite musicians across the region to donate musical doses, to record 5 minutes of music, thinking that they were sending this music to healing patients. And then we had a composer who put the playlists together for engagement in the morning, entertainment in the middle of the day, and energy in the middle of the day, and then evening calm. So we sorted out the playlists, and so people were able to access that through their tablets. But what we found was it was the the frontline workers as well who were accessing this music and realizing that our patients and our healthcare providers both were in need of healing. And so that translated after that hospital shut down after about 8 weeks, fortunately. But we were able to translate that to online virtual lessons for our frontline workers at Mass General, taught by New England Conservatory students who also were silenced. And so I'm thinking again, like Dan was talking about, the museums were also silenced in so many ways. And so what really turned out to be healing for both the musicians and the frontline workers was this collaboration, the intersection, and asking them to bring their best art to the table together, but to reflect then on what that balance was like. And I think looking forward to doing that also in the museum space. What we did for our students was, you can do visual thinking strategies by Zoom. Surprisingly
Have we
works.
done?
Yes, exactly. And it's not as much fun, and you can't tell how big the work of art is. And so you lose that sense of awe and that sense of being in a completely different space because you're still in your living room. But the inner work and the opportunity to stop and reflect and think and share among like-minded people is still there. And so I think that is something that's possible still and probably won't go away because you can do things like VTS and sharing art with isolated patients, with hospitalized patients. And these are people that we couldn't figure out how to access. We couldn't bring them themselves into the museums. How best can we bring all of this to as many people as possible? Because there's so much healing that needs to be going on.
Yeah, I agree. I really feel like technology has opened up a lot of opportunities. And though, as you said, it's not the same as being in person, as we all know, it does still allow us to connect with one another. And I think that human connection is it's such a part of the work that we do. The other thing that I feel like I've noticed during COVID is that workplaces are really starting to acknowledge sort of the importance of honoring the whole person and mental health, and really trying to think of ways to improve the environment that their workers are in. And I think the arts, as you said, bringing this music to the patients also really benefited the caregivers in this particular environment. And so hopefully that will continue to keep growing.
Yeah, and I was interested in the work that VTS at Work, that Corinne Zimmerman and Dabney are doing, bringing VTS and visual thinking strategies and also just awareness of visual things to places that are not even in the healing spaces, but into businesses, design thinkers. Really, it has the opportunity to enhance leadership skills in lots of different fields. And there are lots of different fields in the hospital industry, for example. And just treating the physicians and bringing them to the museum, you're kind of feeling like, well, the hospital bureaucrats would actually benefit from this too. They would learn
Right.
how to speak. Or if you invite,
Right.
the the administrators as well as the nurses and staff and
Mhm.
doctors
Mhm.
all in the same room at the same time, then we can all, be realizing that we're speaking the same language.
Mhm. Mhm.
So the
Yeah,
museum has a
really.
lot of opportunity for that.
I agree. Yeah, I think it really does tend to sort of break down those hierarchies because everyone's kind of in the same place, looking at the same thing or drawing, and it allows people to connect on that human level rather than on the sort of hierarchical level.
Mhm.
So as we kind of wrap up with our last sort of 5 minutes or so here, are there lessons between the intersection of music and health that you feel like museums and museum staff could learn from?
Yes, well, I've had the opportunity to do these workshops like at the National Gallery
Mhm.
in Charlotte, North Carolina, where we've done visual thinking strategies or museum experiences with our participants, mainly from the medical centers, and then we add music.
Mhm.
So as they're looking at art and considering art, then I add Bach, live
Mhm.
music, and it's so wonderful to hear what the observers will say. The art has changed. The way my perspective on what I was
Mhm.
thinking about this piece of art looks different when I hear this music that goes with it. I mean, music is part of it's our soundtrack for life.
Mhm.
So I would love to see more integration, less hesitancy to, musicians know not to take their bows and hit them against canvases or knock down any sculptures. Um, but there is neuroscience, that backs that up, and the whole thing about synesthesia, where what you see, what you hear,
Mhm.
all of those things are so interconnected because it's so close together in the brain. I would love to see closer collaborations with music and art and medicine because
Mhm.
all of those things are have such healing properties.
Mhm. Mhm. Yeah, I agree. I think for me, coming from the other side, coming from the museum side into the medical side, I think what I've learned is that there are so many skills as a museum educator that I've been trained in: communication skills, empathy, audience engagement, curiosity, and creativity. That all of those skills really translate across disciplines and across professions. And so thinking about how, as museum staff, we can use the things that we do every day
Yeah.
to work with other professions and in other areas.
Yeah. And I'm thinking of the watch this space, like Rachel Maddow says, but, the Mass Cultural Council's new Culture RX project
Mhm.
is 1 year old now, and they're moving
Mhm.
forward in that, which is giving healthcare providers the opportunity to write a prescription
Mhm.
for patients to go to museums um,
Mhm.
for their mental health. And, there's just so much opportunity for research in that. Um,
Mhm.
on so many different levels. And I know, Dan said that Michael Bobbitt's going to be here later, but
Mhm.
that will be very interesting to see if, we can, uh, we can on that next level, what
Mhm.
kind of impact that can have. Social prescribing is something that's done much more in Europe, and we haven't done
Mhm.
it as much here in the U.S. But finding those intersections is going to be exciting too.
Yeah, I'm so glad you mentioned that because I do feel like, again, that's a way that this work has really expanded both nationally and internationally. So we can be proud to say in Massachusetts, we are one of the first states to work on social prescribing and to really try and integrate that into cultural institutions and healthcare practice. And Lisa and I are actually on the task force to kind of work on expanding this within the state and study it. And so it'll be exciting to see where it goes, and hopefully other states will start to adopt as well. Welcome back, Dan.
Hi, Dan.
Hey, is it that time?
It is.
All right,
I'm
so
surprised the time went by so fast.
I know.
I know.
Brooke,
So
we
yeah,
could keep talking.
folks, we have about 15 minutes left in our time allotted here, and so this is our Q&A time. So the lines are open, as they say. Everybody, put your questions into the chat over here. We do have a question from Mia. She said, "I have a question. Have there been any studies or work done to explore how music might be used with children dealing with issues such as abuse or domestic violence or other types of psychological trauma. Anyone, Lisa, Brooke, can you speak to that?
Yeah, yeah, there is work being done on that. Some of it is prospective work that's being done in Los Angeles, where they've taken children from the south side of LA, and one cohort is playing music every day, one cohort plays soccer a couple times a week, and then there's a third cohort, but they're from the same neighborhood, and there's being studied not only by educators to see how to do in school, but by social workers and studying how the community responds to children who are playing music. And so there is some work being done that way, and there's certainly work being done with traumatized children, and more in terms of how to help them heal. But the music therapists are really stepping up on that. And what's interesting is, like we were saying with the collaborations in the art world, the music therapists have been doing this work for 40 or 50 years. The music neuroscientists have been doing studies for the past 20 years, and now they're coming together, and the neuroscientists are able to start working with the music therapists and saying, what you observed here, this correlates perhaps to this part of the brain. And so we're bringing all of these, bringing the science and the art together.
Yeah, and I would just add that I think, Lisa and I focus a lot on practice in this discussion, but there's also a big research side to this work, and really trying to show the value through studying it, so that we can convince those non-believers.
I assume that some of the research is similar to what's being done in the research with mindfulness and meditation, fMRI studies and the like, right? That are showing, this definite, where it used to be just sort of theoretical and, oh, you have some benefits just through your direct experience, but now there's sort of this validation, so to speak, for it. And that's, I know what a lot of the companies are using as ways to, utilize it as being a health benefit for the workers and that type of a thing. So that's cool.
Yeah, and interesting that you say that, because I think there are some music neuroscientists who are working with the mindfulness meditation people, because there is some brain overlap in those as well. It's only, the brain's only that big. So
Right. But it does so much. But it does so much.
It does.
It works so
We'll never
hard.
fully understand it.
Okay, so also in the chat, I'm just noting that Scarlett from the NEMA team put up a link to a workshop that Aaron Euskaitis did a little bit ago, using DTS to foster empathy in the workplace. So that's a good tip. Now here, Catherine had a terrific question or a comment, but it's something that I certainly have. Those of us who work in non-art museums might think about our sites, landscape, architecture, and so forth as healing spaces. Then Emily uplifted that, saying, listening to this talk, I've been thinking about a lot about the work history institutions can do in healing as well. Now, the NEMA universe consists of a little over 50% as history museums. So speak to that group. How can a history museum, or anyone else, non-art, get in on this as well?
Yeah, so I would say definitely. I think a lot of the work that I do is spending time with people, making personal connections and sharing those connections. And so I think through history objects, through spaces, through outside spaces, you can do that as well. It doesn't have to be an art museum. It can be any type of museum that can really benefit from this. Physicians can benefit from working there.
I agree. And for us as physicians, just being aware of the human condition and that everybody has a different story, to be able to go to a history museum and delve deeply into some of those stories is something that would, I think, change the trajectory of the training physician. Just realizing that from the surface, this is what the picture showed, and what the story was is this, equal to when we see a patient. On the surface, this is a patient with this diagnosis, but deep down, there's an entire story that blossoms.
And just, Dan, to go back to your quick shout out to Aaron, I would say, Lisa and I are only two of many wonderful people doing this work. Aaron being one of them, Corinne Zimmerman, Daphne Haley. I could name a zillion people who are doing great work in this area. So definitely, it's been growing, and people should check it out.
And I was in Lithuania with Erin and her husband Chris, who's a neuroscience. A neurologist, and so we did some art and healing work there in Vilnius together.
Great, thanks. So here's a comment from my old friend Ann Clifford. Hi, Ann. How you doing? Through the Park RX program, land preservationists and medical professionals are also exploring the connections between open space and mental health.
Oh,
Folks
yay.
were able to access parks during the pandemic, but not museums. Were museums so far down the reopening list because this connection between arts and wellness are less well known or understood? Question mark. She's noting that though.
Yeah.
And
So, sorry, go ahead.
yeah, and then oh wait, okay. So Matt, I thought Matt was commenting on the same thing. But anyway, Park RX program and noting the connection between open space and mental health. And I think the point is that we know as museums in the last year, we played this special role because those of us that had open space to be able to offer to the public, which was maybe off mission to some degree, we had never thought about that open space necessarily as being part of our collection, part of our mission. We're now starting to think of that a lot more deeply as a way to program spaces that we haven't actually fully utilized yet because of the nature of COVID. So I think that's a really good observation.
I know in Europe they're doing research on forest bathing and nature RX as they're talking about just being out in nature and I think it's all of this ties into just the appreciation of beauty and coming back to the neuroaesthetics and to beauty in all the different art forms is where the healing intersection lies.
Yeah.
And I think also taking that time to step away in any profession, to step away from what you're doing on the day to day and spend some time reflecting can be really beneficial.
Yeah. So Matt Kirkman, hi Matt, NEMA board member, said several years ago, I offered a program at NEMA about the intersection of music and exhibition planning. One of the unexpected connections was the lexicon that fit both music and museums, such as pace, vibration, pitch, rest, cacophony, and so forth. Interesting parallel here, of what it is that we do.
Yeah. Is there a paper on that or anything or write about that? I would love to see that, Matt.
Yeah, it's well, we have many of our conference programs, I think, recorded on our YouTube channel. So maybe if we do have that, Scarlett, you could dig that up and throw a link in if we do have it. That might be a little bit of a digging, but yeah, possibly we've got that. Laura Roberts then followed up Ann Clifford's with a comment of saying outdoors RX from the Appalachian Mountain Club. So there's apparently a connection there. And am I assuming does this tie into the actual social prescribing that you mentioned, Brooke? Is this actually, these are programs that medical professionals can actually prescribe a little time off to outdoors RX?
Yeah, so as Lisa mentioned, the Mass Cultural Council has started a pilot program maybe 2 years, with a series of institutions in the Berkshires on social prescribing. And one as an Audubon site, one was a theater company, and one was the Clark Institute. And so that was their sort of initial pilot. They worked with, I believe, a pediatric group out there to prescribe, and then they expanded it right around the time of COVID to 10 institutions across the state, and the MFA was actually one of them, to work with their medical partners, and many of them had already had sort of existing relationships with the medical community, but they wanted to sort of formalize it more and start creating these social prescriptions, which is something that is very common in the UK. They have a sort of government-supported social prescribing system, and also done in Canada, Montreal. Some folks may remember the art museum up there did some social prescribing, but they're starting to do it here. And so those 10 institutions were working with their medical partners for them to prescribe to their patients visits to the different institutions. And it ranged from theater institutions to music to art to museums. It was kind of across the gamut of cultural institutions. And so
Okay.
now they're kind of taking the next step to expand it more.
All right, I have to stop you right there
Yeah.
and ask you, does your medical insurance pay for this?
That is a great question. So that is kind of some of the work that Lisa and I are doing. So what they're trying to do now is really study how this has gone, do some evaluation work, because the next step is that, and you can ask Michael Bob about this on Wednesday. I think the MCC would really like insurance companies to pay for these social prescriptions. Obviously in the UK, they have a very different medical system, and so they do pay for it, but here we're private insurers.
Yeah, it seems to me that it's open to a lot of skepticism in our systems, and and that might be something that our museum folks can do in terms of advocacy, though, is ultimately the acceptance of these kinds of programs is going to be, are they paid for in people's, in their through their insurance and the like, which
my understanding is right now it's being subsidized by the Mass Cultural Council through grants, because it's a pilot, so that the museums are being compensated for entry to the museum and all of that. But the hope is that once there's a prototype that they can present to the insurance companies. The insurance companies are already, I think, interested, because they're trying to figure out how they look better, but how they can contribute to the mental health well-being of the population. So hopefully that will be the step 2.
Well,
but yes, do ask Michael Bobbitt about that.
Okay, I will, and not to hijack the chat here, but one follow-up on that is that it seems that ultimately insurance companies are looking for some sort of objective criteria, right? This works, and you need to sort of quantify it or something. And ultimately, some of this is very unquantifiable, I imagine, which is sort of our issue. So the language that we are dealing with, maybe to Matt's point, the lexicon that we use, and how do we actually convince the insurance companies, say, that this is in fact worthy of reimbursement?
Yeah, and as I said, because we've got this sort of whole spectrum of people who are from the neuroscientists to the educators to the social justice people all along the same road, my hope is that we'll have more and more information, for example, for specific illnesses, right? For Alzheimer's patients in museums. I think that work has been really growing a lot, and for decreasing of stress and mental health. So the people who are working on all of those different fields, we just need to keep the conversation going so we all learn from each other. I was just watching yesterday the WHO conference, and there was a very fascinating talk, a 5-minute talk about Alzheimer's patients, and their eye tracking improves from looking at art. And that actually continues after they've left the art museum. So, things like that, if we can continue to pursue those and show that there's a long-term effect, then awesome. That's what I'm gonna do.
Okay, let's see. We've got 4 minutes left. Larissa from Maine says, greetings from Pejepscot. All right, Larissa, good to see you. Fostering empathy in the medical profession by connecting it with the arts and humanities has been done for more than 2 decades by the Maine Humanities Council, and she gives a link about literature and medicine overview. Great program. I personally directed the program at Vermont Council for a number of years and facilitated programs there and in Maine for nearly a decade. Really no-brainer to work across disciplines like this. Great stuff. So a good comment.
Thank you.
And yeah, it seems like, and then Laura Roberts, Project Fire in Chicago uses glass blowing for trauma relief with youth. This raises the question, is there a resource directory or something? Is there a compendium of programs that are out there that museums are actually engaging in, or is it still kind of a, everybody's doing their own thing? Is this a role for some of our organizations to maybe pull together a list of resources of who's doing what so that we can compare?
I think that's, sorry, go ahead, Lisa.
No, that University of Dallas, remember when we got together, what was that? About 5 years ago.
Bonnie Pittman. Yeah. Yeah, no, I think it's a really great point. There's a ton of this work happening, and it's happening across the country. And I think what people are trying to do now is kind of find a way to sort of bring it together, to let people know that this body of work exists. And Bonnie Pittman at the University of Dallas in Texas is doing some of that work. She has a website that has a ton of resources and lists a bunch of programs that are doing this work. The American Alliance of Museums is also trying to kind of bring together groups of people who are doing this, as well as the National Organization of Arts and Healthcare. So I feel like those of us working in this are trying to kind of, to raise awareness and not have all these kind of little pockets everywhere of this work, and to really shine a light on it as a whole. I think it's still a work in progress. So.
Well, and I'm noting here in the chat, I didn't make it far enough down, but good friend Liz Shapiro from Connecticut has laid in all sorts of links to other programs that are happening through different agencies and the like. Thanks, Liz, for doing that. So our time here is winding up, and I guess we've got a couple of minutes, a minute and a half left for you two. Any parting shots, thoughts, reflections on this particular moment, and final comments?
Sure. But one thing in response to that, if you can collect all of those links and put them up as or a little blog article, that's, I think what I've seen with arts and healing is that, like so many other things, it's accelerated during the COVID times. We had a moment to step back and think. We had a moment to really look and see what we were missing when the museums were taken away, what we were missing when music was silenced. And coming back roaring ahead is the absolute need for this work in the need for this work in good quality, with research, interdisciplinary. So I think we understand that even more now. And so this is a great platform, Dan. If a lot of these resources can be pulled together, I think that will, at least for our New England area, as a good starter, that would be fantastic. And I forgot to do a shout out to New England Foundation for the Arts as well, NEFA, which is also doing work, and they could probably help with that coordination as well.
Well, folks, our time is up. Unfortunately, this really went fast, as I figured it would. Brooke and Lisa, thank you so much for your participation and your wisdom and your energy around this subject. It's something that I think is growing in its importance for us as a field to tap into. And I personally look forward to working with you all moving forward on this subject a lot more. Thank you, everybody. Enjoy the rest of your conference, and we'll see you in the various virtual meeting rooms. Thank you, everyone.
Thank you.
Bye.
Thanks, Lisa.
Thanks, Dan.